Concordance is good. Hello, Caviar Dreamers.
How are you today? We are checking in because we have a lot to talk about.
We do have a lot to talk about. Everyone's taking care of their health, worrying about what they're eating, worrying about what they're drinking.
Some of us worry about what they're eating. But you know what's going to be happening? A trend for the future. My nose is running. Not cocaine, just so you know.
Although that could be fun. Oh no, climbing the wall is not fun.
Not fun. Telehealth. Telehealth is going to be a very big thing. Mark my words. And Natalie Stevens, Dr. Natalie Stevens, who we have on today,
she's a director in ObGyn at Lenox Hill Hospital in New York City. And she has had a private practice on the Upper East Side in the city for over 12 years.
Yes, she's great. And we're going to be talking about telehealth. We're going to be talking everything vajayjay. I know some of our listeners and followers do not have vaginas, but your friends have vaginas. And you know someone who has a vagina. And you came out of vagina. So it's very interesting. Someone came out of a vagina or a stomach or whatever it is, but you came out of a female. So bottom line is
you better tune in.
You better tune in because it's going to be very, very interesting. And we have on Dolores Catania,
a surprise
guest, my girl Dolores, because she is a vagina and she wants to know more about telehealth. And she is very medically inclined. She is not a doctor, but she plays one on TV.
So let's get all our peeps in. Let's get everybody in here.
Yes. There we go. Oh, you look great, Dolores. Well, thank you for coming, Dolores. Okay, here we have.
Thank you for having me. I miss you very much.
I miss you terribly. I was just saying, Dr. Natalie Stevens, thanks for coming. I did a formal announcement on you, and we're going to talk everything telehealth and everything vaginas. Since we all have vaginas, our listeners and followers all have vaginas, and if they don't have vagina, they came out of a vagina. So it's very important for everyone to be on top.
We all have something in common.
Yes, and Dolores, though she's not a doctor, she plays one on TV. So, okay, so Dr. Stevens, tell us, first of all, you're the director at Lenox Hill. Tell us everything, all your accomplishments, because it's very impressive. So you have your own private practice on the Upper East Side.
Yes. So I have my own practice, and then I'm the director of patient safety for the Department of ObGyn at Lenox Hill Hospital. And then I'm a clinical associate professor at Hofstra University at Northwell as well. So a few different hats, but it keeps me busy.
Yes.
You could definitely answer my questions.
Yes. Go ahead, Dolores.
I'll wait. They're good ones. I'll wait till the end.
Okay. Do you still deliver babies?
No. So I delivered babies in my practice for 10 years. And then after 10 years, transitioned into back to a GYN only practice so that I could spend more one-on-one time with my patients and a little time with my family as well.
I know. That's so important because listen, you know what, women need so much help, you know, GYN. I needed a good GYN after I had my child.
I definitely do.
I just want to also thank you. You don't realize Dorothy called you. You helped Marlene, my housekeeper, because she had come to work and her uterus was basically falling out of her vagina when she came to work one day, and she wanted me to feel her panties. It was like a disaster.
Oh my God.
Yes.
The things that people ask you to do, Margaret, you popped a pimple on your friend's ass.
I know.
Feeling Marlene.
A lot of stuff.
Uterus hanging out of her vagina.
And
people don't ask me to do these things.
I guess I look like I'm comfortable doing it. But you were very gracious and you referred her to an amazing doctor, and you basically saved Marlene's life because she was in horrible pain. So I'm very grateful. So thank you. And she's doing great. And
I'm so glad she's doing well.
Yeah, she had a hysterectomy and she has a new vagina and she's thrilled. But I know we're talking today because telehealth is going to be the wave of the future. So do you think GYN and telehealth is going to be, tell us what you think is going to be happening there.
So when I first came up with it, I didn't think this was going to be a go. You know, I mean, who thinks you're going to do a gynecologic exam on telemedicine? But it's actually been amazing. I've had such a great experience, and there are so many things that can be done over the phone. And one of the first things you learn as a medical student is that 90% of the exam is actually the patient history. So when I'm in the room with a patient, I typically know what's going on before I even do an exam. The exam's just to confirm it. So a lot of things can be handled without having them come into the office. And it's a good screening process because people don't want to be out right now. If you can help it, better to stay home. I am seeing a few patients in the office if there's something where I feel like we need to do an exam, but the majority of it can be handled over the phone.
Oh, I absolutely love that. Yeah, because it's like, I always feel like I have vagina issues. Dolores, talk about yours.
I don't usually, I've never had a yeast infection. I mean, I know that you have these issues, Margaret, but I don't know why. I mean, listen, I'm a different breed, Margaret. I don't know. I could probably lick the subway right now. I wouldn't get COVID. It's a lot of things. I'm just like not temperamental like that. For some reason, it's just, I'm not, I don't know what it is, but I'm glad. Although I would like a new vagina, I could use a prettier one if that's the case. I'm not going to say I have the prettiest. I don't think they're pretty at all, to tell you the truth. But my question will be later on. I'm 50, right? I've had a blade. This is one thing I will tell you. I've always had heavy periods, and after I had an ablation, which I've been begging Margaret to do for many years.
Because I bleed, like, Natalie, we have to discuss that.
Like a stuck pig.
Like a stuck pig. Chased her to save me all the time.
Chasing her with a towel. And I mean, I think that, and plus I was anemic. So the ablation really saved me in so many ways. I do not miss getting my period at all, but I would like a new vagina. And, my boyfriend, who's a perinatologist, is like, oh, you'll have lymphatic drainage problems. You'll have all issues. Now, how do you feel about that? Because I'm turning 50 and everything's going to be new. I'm turning back the miles.
So there's a lot of different things that you can do and a whole spectrum on how you can treat the changes that happen as your estrogen level goes down, which is what happens as you get close to 50 and beyond. And then when you stop having periods, the longer you go from that last period, the lower the estrogen is, the thinner the tissue is. So we need to increase the collagen formation. We need to increase the blood flow. And, there's things like hyaluronic acid, like you would use on your face.
Yeah.
Can be used to help the vaginal tissue. Or you can do these laser treatments. I do radio frequency in the office, which is amazing. And then you can, the most extreme would be doing the surgery. And there are some complications that can come from the surgeries, but there are a lot of people who get benefit from that as well. So we have a lot of options because some people can't use the hormones. Women who've had cancer or other issues, it's not even an option. But now we have the hyaluronic acid that we can use instead, which is a nice non-hormonal treatment. But not everybody wants to use something vaginally every night because it can be messy and, it gives you discharge and, it's not the most fun thing to do. So, there's some of the other treatments as well.
That's the first I've heard. Hyaluronic acid?
Yeah, believe it or not. Treats the wrinkles on your face, treats the wrinkles in your vagina.
Oh, I love that. I love that. Dr. Stevens, how do you feel about the estrogen replacement situation? Because I thought I was menopausal. I didn't get my period for 4 months. And then it was, and then I got my period. Now I'm getting it every month again. I was so excited. I was like, thank God I'm through this. I had hot flashes for a few months. And then it was like over. And then I was like, thank God. And then all of a sudden I got my period. Now I'm getting it every month again, like clockwork. So do you do a test for hormones? What do you do there?
As you get closer to menopause, you can have a lot of changes. And hormones definitely have a role. And some people definitely need hormones, but there are a lot of things that should be addressed. So as you get closer to that last period, if you ever start having heavy, frequent, or prolonged bleeding, these are warning signs. And these are reasons why you should get into your gynecologist and be seen. Once we figure out that the blood tests are okay, that the lining of the uterus looks okay and everything else is fine, then there are a lot of options. And it's really tailoring it to the individual and finding what's bothering you and how can we fix it. And it may not be the hormones. It might be something else that's bothering you with the transition. But sometimes it is the hormones. And really it's finding if it's safe for you to use it and which type of hormone you need.
Yes, because it's like, listen, no one wants blood clots and you get nervous of
Right.
breast cancer and things like that, which is, I also, Dolores, which I get UTIs very easily. I have a history of UTIs since I'm a young woman. I was on antibiotics prophylactically. you know, women, if you're having sex, I do everything you're supposed to. I wipe from front to back. I pee after I have sex. I do everything possible. I like to think, you know, I'm pretty clean. I do everything possible. But that's something you could diagnose over the phone, obviously, like telehealth or the Zoom, whatever we're going to do. I mean, what do you tell somebody who has chronic UTIs?
So it really depends on their life, their age in life and where they're at. So for somebody who's around the menopausal transition, one of the main things that causes those urinary tract infections is a thin tissue. So actually that can be a low estrogen level inside the vagina, causing the tissue to be thinner and more prone to getting these infections. Some women who are younger, they're more prone to overgrowth of bacteria inside the vagina. And that bacterial infection or bacterial vaginosis can increase your risk for getting urinary tract infections. So it may not be hygiene, it may not be something that you're exposing, it might be an underlying condition that needs to be corrected in order to decrease your risks.
Yeah, how do you keep that bacteria down? I feel like, because I've had it my whole life. I don't want anyone to think I had bacteria.
I feel like maybe I'm not a doctor, but I date enough of them. So I'll tell you, Margaret, that I think that the amount of antibiotics you've been on has probably killed a lot of your normal flora, which has been causing maybe that to be a problem, right, Doc?
I have taken a lot of antibiotics. I am a little neurotic.
Yeah, and it can disrupt your flora. And sometimes women actually overclean. You get rid of the good bacteria that should be there protecting the area, and it gets rid of a protective film, a protective layer. And so you want to be careful with not using antibacterial soap around the vagina, because that can actually get rid of some of the good bacteria that you need. You don't want to overwash. And actually, some of the products that are advertised as feminine hygiene products can be very harsh. They may contain alcohols or perfumes or dyes, and these things can make it more irritating and actually cause little micro cracks in the skin that increase the chance of having the bacteria.
I know. So what was I going to say? Lexi has some questions. Yes. She's a new mom.
Okay, so
congratulations.
Thank you. My son is 18 months old, and I had a very easy delivery. Margaret was there holding one of my legs.
I was.
She was amazing.
Great.
Much better than my husband. I shut him out like it was a spin class. It was great. But since then, every time I sneeze, laugh, or cough, which I had a cough recently, I was not concerned I had COVID, but my vagina was like Splash Mountain. I literally pee my pants all the time. It's so embarrassing. My husband is making fun of me. Like, I sneeze and I pee. I laugh and I pee. It's very non-conducive to regular life. What can I do?
So again, we've got lots of treatment options for you, and it really just depends on sort of what your life plans are. So if you're planning on having another vaginal delivery in the next year, then obviously you don't want to go a surgical route or something that's more extreme. You want something that's going to help you over the next year. You have your next baby, and then, then we do something a little bit more permanent when you're done. So for the short term, the first thing is Kegel exercises. And the way you do a Kegel exercise is if you're in the bathroom urinating and your little one comes to open the door, or your husband, or somebody, you want to stop peeing midstream.
There's no privacy when you have kids. You know that.
I know there's not. That's why I changed my story to your husband. To open the door, and you want to stop peeing midstream. The way that you do that when you're not urinating, you want to contract that muscle, hold it for as long as you can, and do it for 30 times throughout the day. That's going to strengthen the pelvic floor, and it actually lifts up the angle of the bladder. You're not emptying your bladder all the way, and then you get up and the angle comes down, you cough, it lifts that angle up, and the urine comes out. So you might notice that you sit down, go to the bathroom, you stand up, and you have to go again because the bladder angle changes. But if you strengthen that muscle supporting the bladder by doing your Kegel exercises, that can help give you about 30% improvement.
That's pretty good. 30%.
Yeah, it is. You can
Lex,
also
there's this thing you could buy. You put it between your legs. I saw it in CVS. A little Kegel thing.
Perfect.
Google it.
I'm going to Google that.
And then, the same as we were talking about for perimenopause, you can do the radiotherapy. You can do that for the incontinence after childbirth as well, because it thickens up that tissue, makes it stronger, increases the blood flow and oxygenation. So not everything has to be surgically corrected, but that would be an option if nothing else works.
How many sessions of that do you need? Didn't Marge Senior go for that? Isn't that what Martina
I think
did?
my mother did. She did some kind of laser she had to do
The
3
Venus
times.
test?
No, it was the Mona Lisa
Mona
thing.
Lisa,
Is that what that is?
So the Mona Lisa is one of the options. That one's based on a carbon dioxide laser. The one that I use is radio frequency. The difference between the two as far as who it's good for is that Mona Lisa is really good for menopausal. It's good for that thin tissue. The one that I have, the radio frequency, is good both for menopausal tissue, but also for premenopausal tissue for strengthening up the muscles in the pelvic floor. So it helps with urinary symptoms. It helps with satisfaction during intercourse, that sort of thing.
Oh, so it helps your orgasm.
It can. It makes everything a little tighter, a little bit more blood flow to the area. So yes.
Does it
Do you believe in that shot, Doc? That what is it? The G-spot shot. It's a shot. They take your plasma, they spin it, and then they give you an injection in your. People say that a G-spot doesn't exist. I don't know. I'm okay with everything.
So I don't have any experience with that. I can't say yes.
You know what I'm talking about,
I know what you're talking about.
Okay.
Yes, I'm familiar with it. I just don't have enough background on it to say whether it's good or not.
But does the
Margaret's gonna try it out for us.
I'm gonna try. Yeah. No. Does the laser that you use, does that help with the juiciness?
Yes, it will help with lubrication. It helps increase the blood flow in the circulation.
Juiciness is the new word for lubrication, Doc.
Yes.
When
Interchangeable.
Well, but lubrication just sounds so formal. Juiciness sounds so much more youthful.
Yes, so it definitely will make you more juicy. Yes.
How do you feel about people bikini waxing? I mean, do you feel it's healthier? What's the point of pubic hair anyway?
I would never bikini wax if you paid me.
Dolores,
That shit hurts.
Full-grown 70s bush?
No way, I shave. Or I'm gonna get laser hair. I'm not that hairy. It's the Irish part of me, I guess.
I'm not that hairy either, personally. I'm not that hairy. But Dr. Stevens, do you feel the hair there for a reason? Like, what's the story?
So it's a great question. When people remove all of their hair, we do see more things like maybe some more infections. Some women are more prone to get superficial cysts or almost.
Maybe that's why you're getting all those urinary tract infections.
I've gotten them since I'm very young, Dolores. And
they used to do Brazilian waxes when we were young. I used to do them in the hair salon when I worked when I was 16. I lied about my age.
In general, most women can do any of these things: the bikini wax, the shaving, laser treatment. But some women do need to have one preferentially. If you're starting to get ingrown hairs, laser treatment may be a little bit better. You do want to make sure that if you're getting waxing done, that you're going to a good salon. You want to make sure they don't double dip, that, they should have a grade A rating outside the door.
Yes.
As long as it's someplace that they're doing it right, the wax isn't too hot and you're not sensitive. Some women do have allergic reactions to it. It's fine. We also see some allergic bad reactions to that Nair product that is the home removal kit. So during COVID, be careful with that.
Yes. I feel like I'm just.
Oh, right. People are using these things. We're reverting back to all these things we used to use before things exist. It's terrible. Oh.
Can you get problems from ingrown hairs? Like real like ObGyn? Because I get so many ingrown hairs, and I don't
get any.
And I could pick them, and that's a bad.
Oh yeah, definitely don't pick and don't squeeze. Those are the two things that you could possibly do. But if you get recurrent ingrown hairs, you can start to get what's called a sebaceous cyst, where you have a growth that doesn't go away. It's not going to turn into cancer. It's not dangerous, but it hurts and it's problematic. You don't want to ride your Peloton if you've got an ingrown hair in that area. That's not.
Oh my God, I never thought of those things. I'm not riding the Peloton, Doc.
I don't think you're
riding in a Peloton group. I know all these women. They have their like lingo for this and stuff. It's not for me.
Let me just tell you, I've had friends that have issues who are very big spinners it's caused them problems. Could that cause you numbness, issues?
You can definitely get a neuralgia or a numbness. A nerve can get damaged by repetitive trauma in the area. So it's important that you're not sitting the whole time. You do have to go back and forth. And if you start to notice a problem, you should be seen for that. Other things we see, very common to get yeast and bacterial infections, vaginal infections. Also, you can get something
That's why I don't work out. That's one.
So the solution to all problems is not exercise.
I agree.
But you can get some abscesses as well. So it's important that if you do start to have a problem, it can be handled on telemedicine.
I know.
How do you feel about the ablations though, Doc? Like women our age at this point, we're not having children anymore. We're over it. Are you for ablation or uterine ablation or not?
So, there's a lot of opinions, very strong opinions, one way or the other. In general, it's definitely considered an accepted treatment. It's just very important that if a woman does go for an ablation, that she has her endometrial lining checked first, because heavy bleeding can be a warning sign for uterine cancer or precancer. So it's important that it's checked beforehand, because when you're doing an ablation, you're burning that lining of the uterus. And if there are any abnormal cells there, they could be hidden behind the burnt lining. So the concern is that you lose that warning sign of heavy bleeding. So some doctors are against it because they like to have that warning sign. They want to be able to pick it up early. With that said, definitely it can be a lifesaver for many women. When they have the irregular bleeding and the heavy periods, this is one of the things that can definitely stop it. We have newer alternatives now that we didn't have before.
Like what?
A lot of women are actually around the time of menopause, or even most common in their 40s, getting a Mirena or a levonorgestrel IUD. It releases progesterone locally to the lining of the uterus, but not through your bloodstream. So your hormones aren't changing. It's not hormone replacement therapy, but it's protecting the lining of your uterus against cancer, and it'll make your periods go away. It's good for 5 years.
That sounds amazing.
Yeah,
do you know I've
good
never been
option.
on birth control in my whole entire life?
I haven't
That's
taken
very
it
impressive.
Since I was 14. I get very nervous.
I was always afraid to gain weight.
I know.
I'm afraid to go crazy. When I was younger, it made me very crazy, so I didn't take it.
I had very bad migraines, so I was on the pill for a few years, but I went off it by the time I was like 24 because I had very bad migraines. So I was on it a few years only.
Yeah.
Did it help?
Until it came out.
And then I never went on again because I had a baby, and then my ex, and then my current husband and my last husband is fixed. So my current and last husband had a vasectomy, so we're good. How do you feel about birth control pills, doctor? Because there's
So it has changed so much. I remember I was on birth control when I was a teenager, and the amount of hormone that was in that pill was ridiculous. And so anybody on that birth control was sort of definitely feeling the effects, feeling a little bit crazy from it. Birth control now, we've got a lot of low dose pills, and there's many options. In general, you should feel as good, if not better, than you normally do on a birth control pill. And if you don't, it's not the right pill for you, and you should do something different. But in general, most women should feel better on a birth control pill because it's regulating your hormones. It's giving you a constant low dose instead of the fluctuations that we get naturally.
So do you suggest somebody that like Margaret, who's going through menopause and now getting hot flashes and sometimes her period and sometimes not, do you think that that's something that would work for her?
So, birth control pill can definitely help with a lot of those things. You have to be careful with the migraines, though. If you get migraines where you get vision changes associated with it, you should not be using the estrogen. So I've had a lot of success there's a new generation of progesterone-only birth control pills. And, it's similar to the mini pill that's used postpartum, but this one has a longer half-life. And I found that a lot of times if you do that continual, it will help with a lot of the side effects. It doesn't help with everything, but as I said, it's really finding the treatment that's best for you in order to help with it. But a lot of times we can help with that bleeding, with the hot flashes, and a lot of the changes that can happen.
How do you know if you're going through menopause? Let's say, if you're still getting your period, well, I guess that's the best sign. Now that I've had an ablation, I don't get my period for that reason. How do I know if I'm going through menopause? Besides the fact that I'm fat, miserable, crying every day, lose my hair, and, but that could have everything to do with being stuck in the house for 50 days.
Yeah, and a lot of that can be hormonal. A lot of it can have to do with lifestyle changes, sleep change, diet change, exercise change. Everybody's going through that right now. So I'm seeing a lot of people who have perimenopausal symptoms just because their lifestyle has changed so dramatically recently.
So you feel that it's kicked in, the stress has kicked in early menopause? Of course.
Well,
there you
no,
go.
I don't think it's
Adds to the
necessarily
list.
early menopause. I think it mimics menopause. So it may
Oh,
be permanent. For example, if you go back to what you were doing before we all isolated and, increase your activity level, watch your diet, try and decrease your stress level, try and get a good night's sleep, then a lot of times that can actually help. And some of these symptoms will go away. Can fix hot flashes, night sweats, a lot of that.
No.
okay.
At what age do you start suggesting that women go for mammograms? Do you start them younger these days?
So it really depends on your history. We have to balance. We don't want to expose you to radiation necessarily either, because that can come in with its own set of problems. So it's really getting that good patient history, finding out what the family history is. We do a calculation to determine your lifetime risk as well as your 5-year risk of breast cancer. For most women, that risk is going to be around 13% for lifetime, and that's the woman that would start at age 40. For somebody who's got an increased risk, would probably start sooner, and that's assuming that your breast exams have all been normal.
And then
So why?
Go ahead,
Sorry.
Dolores. No, go, Dick.
So if there is radiation and everything, and I'm not one of those people that say I don't want to go for an MRI because I don't want the radiation, and I don't want to go for a mammogram because of the radiation. But you did mention that there is like radiation involved. Why would we not do a sonogram instead of a mammogram?
So actually, we typically are doing both for most women. A lot of women have dense breast tissue, and dense tissue will significantly limit the amount of sensitivity of a mammogram. So the mammogram can't pick up everything, but it's good for early detection of calcium spots and solid masses. Sonograms are great for picking up cystic or fluid-filled spaces. So really, it's using the combination of the two to make sure that we're getting that full screen. So you can't really replace a mammogram with a sonogram, just the same as you can't replace a sonogram with a mammogram. Really, if you have dense tissue, you should be doing both.
So I haven't been for a mammogram and I want to say 3 years. Is that bad?
How many
We need
years?
to get you in.
Dolores,
3 years.
I'm 1.5 years. I think I'm at about, well, it's time for me to go. I went, but I think
Time to go.
COVID. I went last year, I think in January.
And I didn't even get my first one yet because I don't turn 40 till Christmas. So lucky me. It's the year of the mammogram.
But I always go for a sonogram.
Mm-hmm.
Yeah, they always do it. And, I'm always in a panic-stricken state. But I don't have a history of breast cancer in my family. My mother, no one in my family has ever had breast cancer.
Yeah, and it's almost become the standard now, but to have both that mammogram and breast ultrasound together, the sonogram.
What,
Okay.
Yeah, which is very, so now what are you telling your patients now? Do you see that obviously people aren't coming in? Are you trying to tell everybody do a telehealth visit? Oh, I mean, you obviously can't do pap smears over telehealth, but are you doing it just for well visit? What do you, for people who are sick?
Who goes to a well visit for the gynecologist?
Not well visit, but
I don't want to go at all. You go there, you're already sweating in your hands. Like you still think you smell even though you took a shower. Yeah. It's just like not my pleasant visit. I'm not running there, but so I go when I have to go once a year.
Yeah. So tell me what people are, do people are calling in telehealth because they're not feeling well, because they have an issue? Tell me the story. How can we?
So I have a lot of different things that I'm doing on telemedicine right now. The main ones are going to be irregular periods, just for the reason that we talked about. People are changing their lifestyle, their diet, their exercise, their stress level. And that one of the first things that can manifest as is irregular bleeding.
Oh, Bella.
Period, or they got an extra period. So that's probably the number one. Also, a lot of hot flashes and night sweats because the lifestyle change affects that as well. And then I'm getting a lot of birth control or preconceptual. People either want to start their birth control or stop their birth control. People are making a lot of life decisions right now. They want to know how COVID plays a role with that. And then, I have a lot of healthcare workers who really, they don't have access to somebody that they've got that relationship with. And maybe I delivered 2 or 3 of their children before and we've got that bond, or I know them from the hospital. So I am seeing some people with anxiety and people who just need to talk and get set up with the right type of care right now. So it's a wonderful opportunity, and it's so good to be able to see everyone because I can see actually how they're doing, because when you get that face to face, you can't really, hide it as well if you need to talk to somebody, or sometimes I see the kids or the pets, or
Yeah. Oh, that's so nice.
so it's a good experience.
Tell me what else the GY, people don't probably realize they can go to their gynecologist, not just for care for their vagina. What else can you be doing?
Your front door is wide open.
I didn't know that. Oh, the front door was wide open and we could have been kidnapped and the door was wide open. I guess it's so weird.
Oh my God, Bella could have ran out.
Yes, my husband was like very nervous.
not
He
know
said the
that.
front door was wide open. It must have the wind. It's very windy here
Very
today. Is it very windy by
Yes.
you guys? There was a crisis averted. Crisis averted.
Good.
So what else can people go to their, you specifically? What else do you do? You deal with things like, tell me what else that you do for your patients.
So I really do all over women's wellness. So from head to toe. So any mental health changes, trying to give them the lifestyle. I address diet, exercise, to some degree, cardiovascular health, making sure that they're getting their screening. But every woman, I make sure that their milestones are up to date. Did you have your colonoscopy? Have you had your mammogram? Are you wearing your sunscreen and going to the dermatologist? So there's a lot of, it's basically the woman's wellness exam, but then there are other issues that can come in too. And sometimes women are coming in and what they come in for is not really what they need to see you for. There might be something else going on that they're concerned about. And that's usually the, oh, by the way, as you're walking out. But sometimes it's for a referral. Sometimes it's because they're having problems at home that they need to talk about. And sometimes it's because they're really afraid that they're never going to be able to get pregnant or have children, even though they're not in that stage yet. And they just want to talk about it or have that reassurance. So, it's spending the time and being able to find out. But this is one of the great opportunities we have by doing this telemedicine communication and, having time to just talk.
Oh, that's so nice. It's more personable anyway, right?
It really is. Is.
I really think this is going to be the way of the future, personally, this telemedicine, because everyone's not going to be ringing to the doctor just for even a cold, right? I feel like it's just going to be so much easier. You might see patients in the morning and all afternoon. It's quicker. People don't have to come in, get naked, get on the scale for, a quick check-in. Like if I'm calling you, Dr. Stevens, the Marge, I have a UTI. I have this, I have that. You want to call me. You want to know my symptoms. Is your urine, it's just easier for everybody. And don't you think that's the way of the future with every kind of physician, not just yourself?
No, I absolutely do. I think that it's going to really change how we're doing medicine. I think that, we're learning so much every day, and this is definitely a lesson learned on how well we can help people with just doing this. And then, if we treat it and it's not getting better, then, yes, come into the office. We'll see you, make sure that everything's good. But if we can save that, that exposure and save that trip and save you from having to, cancel your meeting at work, even better.
What do you think, just question, is a must-have for women, of all ages to stay healthy? Like, is there something you should be taking to keep your vagina healthy separately?
So I think the most important part is overall wellness. If you're healthy, your vagina is going to be healthy. So it all comes back to being in balance. Now, there's only so much that you can do, of course, but if you're getting, a good night's sleep, if you're getting a healthy diet, you're exercising, you're keeping your internal hormones in balance, and that's going to be the first stage. And then beyond that, you don't want to pay too much attention to your vagina. If you're overwashing, if you're overchecking, that's when you start to come into problems. So, I like to tell people to treat their vagina like a rose. Be very gentle with it. Don't put anything on it that you wouldn't put on a rose, and, just take care of it.
Oh, all right. That's a good way to think.
There was this thing, I was listening to the podcast, Call Her Daddy. None of you have ever probably heard of it, nor would you even. Okay. Doc, I'm sure you went.
Daddy yet. They're very outrageous and hilarious.
They're hilarious. And they were talking about this new suppository for your vagina. It's like Famali or something. And of course, David has to knock that too. It's like for juiciness, like you were saying, and all different kinds of things for it. And he's like, oh, that'll throw off the pH. So like you were saying, just leave it alone, I guess, right?
Yeah, and you have to be careful. I mean, there are things that are specifically created and tested to make sure that it's not throwing off the pH. And those are what you want to stick with. You don't want to go on Amazon or Google and find something and put it inside your body internally. Let's stick with what's been tested, what we know is safe, or just minimal. With that said, I mean, there's a lot of things that women can use now that they do have in their home. Olive oil is a great lubricant. So if women feel that they're having dryness, which can happen, they can use olive oil or mineral oil, but you want to be careful not to go on some of the other products.
So I want to taste like a salad. I mean, I don't know.
What about
But
coconut
stuff
oil?
it makes you taste like pineapples. You could get cherry, coconut. I'm not kidding. I read about it.
Yeah, that I think you have to be careful with. You definitely don't want to have an allergic reaction down there.
I like the smell of coconut.
Coconut we like.
Coconut oil,
Yeah.
Stevens?
Yeah, some women do use coconut oil. You just want to, do a skin test first. Make sure you don't have any sensitivity before you do something like that.
So more natural. Everything that's natural.
Can we go over the milestones really quick? Because I am known to miss the doctor and not take good care of myself. My water was broken for a whole weekend and I didn't know it. I
Oh
didn't know
my
it was
God, Lex.
Yeah. I had a force.
And you're married to a nurse.
I know we have terrible medicine in England, so we don't like to go to the doctor. So I'm fine is my way of dealing with my health. So what are the milestones?
So for the average risk woman, it's really important that you have that relationship with your gynecologist and that you're going in to be seen once a year. You don't need to have a pap smear once a year. If your pap smears are normal, that may be spaced out to every 3 to 5 years.
Really?
Wow.
But you still need to have your gynecologic exam. You still need to have a vaginal exam, check to make sure that there's no signs of lesions, no masses, your ovaries are normal in size, and you need to have that breast exam done. We had talked about doing mammograms, but it's also important to have your blood pressure checked, to check your weight, make sure that your appropriate BMI, and then you want to make sure that your cardiovascular health is good. So checking your blood pressure every year, checking your lipids, and making sure that your cholesterol is in the right range. If that's good, that's something that can be spaced out. Doesn't have to be screened every year, but if you're at elevated risk, should be checked more often. Colonoscopy should be at age 50.
Sorry, I shut my window, guys.
That's all right. It's sounded like you flushed the toilet.
No,
Speaking of colonoscopies.
Sorry.
So, colonoscopy at age 50, bone density after menopause, depending on your risk factor as far as what age you start that. So it's really just, coming up with a combination and individual maintenance plan. But then every year, if you're going in for your appointment, it's like, okay, you've got 2 more years until this is due. You've got 1 more year until that's due. And having sort of that gatekeeper that's reminding you on all of your milestones.
Yes, I've got to do, I have to do my colonoscopy. I just turned 53. I haven't done it yet.
Oh, bad.
Very bad. Very bad. But I don't have I have no blood in my stool though. I'm just making a formal announcement.
No, but you should go. It's the most preventable form of cancer there is.
I know.
Right, Doc?
Yes, it's very important to do your screening so that if there is anything there or any precancers, that it can be picked up in time to prevent an actual cancer from forming. And that would be the goal for preventative medicine.
All right. Well, I love that you are so thorough and so plugged in. And I love that, you're just focusing on women and not just worried, because there are so many doctors that are OBGYNs. And I think that your specialty is just women's health, which is so amazing.
Yes, thank you for that. And it's so nice that you've been such an amazing doctor to people that have had babies in the past, that they still come back to you just to talk to you or trust you for a referral. And you must have made a lot of nice experiences for people in this field. So kudos to you.
Thank you so much. It's an amazing, amazing thing that I do. I'm so grateful every day that I get to be part of women's lives this way and just really, really have that special bond.
That you've made such a difference. Well, thank you so much for coming on the podcast.
Nice meeting you.
Thank you for having me. It's been such a pleasure.
I need people to know where to find you so I can put it on the website and then we can refer them. So where should everybody find you?
So my office is on the Upper East Side, but you can find me online now. That's how most people are. Dr. Stevens, OBGYN.com. You can also call my office anytime, 212-717-1700, and we'll get you right through.
Okay, great. And on Instagram, I know you're probably not a big Instagrammer, but you should know that you're going to be doing your your telehealth.
Yes. So it was actually very fortuitous. I learned how to do Instagram in January. So
Congrats.
Oh, very good.
Actually, I have two. So Dr. Natalie Stevens and Natalie_Stevens_MD. I'm there.
Great. Well,
Thank you so much.
This is so
Thank
informative.
you.
Thank you so much. I look forward to meeting you and seeing you and coming into the office for an exam. And you can keep me on track because Dorothy speaks so highly of you. She's going to be and we love Dorothy, but I know what a medical neurotic she is. So
yes.
Well, thank you so much. This has been amazing.
Only medical. It's everything.
Thank you.
We'll be seeing you soon, Doc. Thank you.
Thank you.
Dolores,
I appreciate it.
Bye.
Take care.
Thank you. Bye.
Bye.
Thank God for Dr. Natalie Stevens coming on today. I know I had a lot of personal vagina issues that I shared with you there.
I know. And Lexi's vagina issue. She has a young vagina. My vagina's a little older. But I also think it was great about the telehealth. Yes. And Dolores was great. She doesn't seem to have any vagina issues, though she doesn't even like to go to the fucking doctor because she's a doctor.
So she wouldn't know if she had any issues.
Well, her boyfriend's a doctor, so thank you, Dolores. So
yes,
she gets to see one every night, so she's fine. But I think it's very interesting because she was in ObGyn and then she decided just to be a GYN to do women's total health, which I love that.
I love that. Listen, what about the episode of Sex and the City where Charlotte had a depressed vagina?
Yes, I agree.
She officially had vulvodynia. Vaginas are very sensitive to how you're feeling, people.
Exactly. So if we're stuck home right now, or you're in the house, you could be depressed, you don't feel like having sex, or you're just not feeling healthy, or if you're having a UTI, if you're having issues, you're not running out to the doctor now. So this telehealth is great. You can just call in. She's doing telemedicine. You can look her up, Dr. Natalie Stevens. She gave her phone number. You can follow her on Instagram. Absolutely amazing. Great ideas. I might go in for a little laser. I don't need a lift. I don't need a lift in my cooch. But
yeah, I just want to clarify. I don't need mine to be tighter. I just need to stop peeing my pants.
Yes, exactly. I'll just get her little diapers. We'll be fine.
My bites. No.
Okay.
But everyone, take care of your health. Even outside of that, telehealth is there to help you. So just because you're stuck home doesn't mean you can't take good care of yourself. It's very important to be as proactive with your health as you are with everything else.
Yes.
I haven't been, and it bit me right in the uterus.
Yes. And I'm a total hypochondriac. So I love to go to the doctor. So this is like torture for me. So for me to have any kind of telehealth is unbelievable. I'll be FaceTiming, calling the doctor.
You'll be the number one fan. You'll be taking up everybody's time.
I'll be taking up everybody's time. I'll be bending over naked in front of the screen. Only kidding. It'll be great. Only once I'm waxed, which has not been happening now. Yes. Okay. So, okay, Caviar Dreamers, take care, stay healthy, love you guys, and keep tuning in.
Yeah, don't forget to tune in every Wednesday and Friday now. We'll also video at Caviar Dreams, Tuna Fish Budget on Instagram and on YouTube at The Real Margaret Josephs at The Life of Mrs. B. Keep dreaming.
Keep dreaming, Caviar Dreamers.